Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Now, Mr. Johnson, I understand you've been referred to me by your primary care physician to discuss the medications you've been taking for your rheumatoid arthritis.
That's correct.
Can you share with me a little about your experience with rheumatoid arthritis? When did it begin?
It started seriously about 2 years ago. I was on a business trip and I woke up with this horrible pain in my wrist. Initially, I thought it might be due to my laptop usage, as I have a job that requires a lot of typing. But then my wrist got red and swollen, and the pain just wouldn't go away. It was so severe that I was having trouble just holding a cup of coffee.
I see.
I got really worried and thought it might be a sign of something more severe. It was that painful, so I decided to seek medical help. They initially thought it might be carpal tunnel syndrome, but after a blood test and an X-ray, they diagnosed it with rheumatoid arthritis. To be honest, I was shocked because I always thought arthritis was an old person's disease, and I'm only 45.
It's a common misconception.
Yes, and I've been having these flare-ups more frequently ever since. It affects my hands and wrists mostly, but sometimes my knees and ankles too.
What medications have you been using for the pain?
Initially, the doctor recommended some non-steroidal anti-inflammatory drugs, but they didn't really help much. Then I was prescribed something.
Methotrexate?
Yes, that's it. It did help with the pain, but it made me feel nauseous and tired all the time. I couldn't really function at work, so I had to stop taking it. The doctor then prescribed prednisone, but that led to weight gain, and I also started having mood swings.
Yes, those can be side effects.
After that, the doctor suggested we try Humira, but that gave me a skin reaction, so I had to stop it. At that point, she referred me to you, the specialist. I really hope you can suggest a more effective treatment.
I understand your concerns, Mr. Johnson, and I assure you,
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Mr. Thompson?
Yes.
I'm Dr. Harrison. Thank you for your patience. Could you tell me why you've come to the ER today?
I've been back from a trip to Asia about a week now, and I've just been feeling sick since I got back. I initially dismissed it as jet lag since it was quite a long trip, but it's just been getting worse. I've been having high fever, terrible headaches, and I've been feeling incredibly fatigued. I don't usually fall ill, so this really got me worried. I thought it could be meningitis, so I contacted my doctor. He suggested it could be dengue, since I mentioned that I got a few mosquito bites while I was there.
I see. And what was the course of action suggested?
He recommended that I get tested, and in the meantime, he gave me a medication. I can't quite remember the name.
Was it paracetamol?
Yes, that's the one. But the fever hasn't gone down, and my headache has been getting worse. I've been vomiting a lot since yesterday, and that's when I decided to come to the ER.
That's quite concerning. You did well to come in. We'll need to conduct a few tests. Have you been experiencing any difficulty in breathing?
Not really, but I've noticed that my heart's been beating faster than usual.
Understood. And have you experienced any abdominal pain or any rashes?
No abdominal pain, but now that you mention it, I have noticed a rash on my legs and arms.
Okay. Did you take any vaccines before you left for your trip?
Yes, I got shots for typhoid, Japanese encephalitis, and hepatitis A. I've taken them before without any problems. During the trip, I was feeling perfectly fine. Normally, I'm quite healthy. I did have a prostate cancer scare a few years ago, in 2015, but it was managed with surgery, and I haven't had any problems since then.
All right. This could potentially be a reaction to the medication or something else. We'll need to run some tests to be sure.